So most people get braces as a teenager, but at some point during their adult years, their teeth shift. So why do teeth shift after braces? How do you prevent them from shifting, and how long will teeth keep shifting after braces? This video we're going to break down these important questions and outline exactly what you should know about teeth shifting after braces. That way you can keep your perfect smile long after the braces are removed. So why do teeth shift after braces? Most people don't realize that your teeth never stop moving. As long as you're alive, your teeth will always be in motion. So think about your muscles. If you go to the gym, you can make your muscles stronger, and when you stop going to the gym, the muscles weaken. As you age, muscles naturally get smaller and less strong, but at no point in your life do your muscles stay exactly where they are. It's the same with your teeth. They react to the forces placed on them, and everything from pressure from your tongue, pressure from the gums, biting pressure, pressure from your cheeks, can impact the position of your teeth. So when you're in braces or Invisalign, teeth are safely moved into an ideal position. In other words, braces apply forces to the teeth that are stronger than all the forces acting on them from your body. That's how your orthodontist is able to determine exact placement for perfectly straight teeth. But as soon as the braces are removed or Invisalign is stopped, the teeth are at the mercy of your bodily forces again, primarily from tongue, cheeks, biting muscles, and gums. And this is where retainers come into the picture. Retainers are placed after braces to counteract the forces that your body will naturally place on the teeth. These retainers are designed to prevent unwanted tooth movement and keep them in as close to ideal position as possible. So how long will teeth shift after braces? Unfortunately, teeth will never stop shifting. It's just a fact of life. As long as you're alive, your teeth will continue to react to the forces placed on them. For some people, the teeth will find an equilibrium and stay in a good position even without a retainer. For others, unwanted tooth movement can occur if retainers aren't used due to unequal forces placed on the teeth by either the tongue, cheeks, lips, bite, or the gums. So anything from a tongue thrust, strong jaw muscles, or a forward tongue posture can impact the position of your teeth. It's nearly impossible to know whose teeth will be relatively stable and whose will shift a lot. That's why orthodontists recommend everyone get a retainer and adhere to wearing the retainers for life to prevent unwanted teeth shifting. So how fast do teeth shift after braces? The first 3 to 6 months after braces are removed are the most unstable period for your teeth. That's because your gum fibers while in braces stretch, and once we remove the braces, these fibers act like a rubber band and want to pull the teeth back to their original position. This creates the potential for teeth to shift very rapidly right after braces are removed. After this 3 to 6 months, the gum fibers will remodel and the teeth will get more stable, but that doesn't stop other bodily forces from having a say about the tooth position later in life. So tongue pressure, lip pressure, cheek pressure, and biting forces can still move the teeth, but these tend to occur over a long period of time and happen in small incremental stages. You may not notice these changes overnight, but gradually the teeth will move. Eventually the tooth position will be quite different from when the braces were removed. So some have asked why their teeth shifted after braces even when they had a retainer. So some minor tooth movement is possible and often expected with good retainer wear. That's because the retainer is trying to hold all 28 teeth in perfect position. And as you can imagine, this is difficult and it's impossible for 1 or 2 teeth to lose their perfect position even with the retainer in place. If some minor tooth movement occurs, but overall the teeth still look good and are in a healthy position, you usually have nothing to worry about. If major tooth movement occurs while wearing a retainer, it's possible that the retainer was not properly fit, and if you have a permanent retainer, you may find that it is broken or defective after long use. So in some cases, the pressure exerted on the teeth by the tongue, bite, or lips may be so strong that even a retainer may not be able to fully keep them from moving. There are so many factors involved with keeping teeth in their proper position, and that's why it's important to ask your orthodontist if you have any concerns about your teeth shifting. But practically speaking, most shouldn't expect their teeth to remain 100% perfect for life, even with proper retainer wear. Our goal is to minimize movement as much as possible and keep the teeth in a healthy position at the same time. So lots of patients have asked if they can wear their old retainer to shift their teeth back. If you've stopped wearing your retainer for a short period of time, usually less than 1 month, and you notice some minor shifting, you can try to wear your retainer to see if your teeth will move back. So do note that this doesn't always work. If the teeth have just minor movement and you're able to get your retainer completely in position, there is a chance the retainer will move your teeth back into the correct position. However, if your teeth have moved too much, and if you aren't able to get your retainer fully seated, you will most likely not be able to correct your shifting with your old retainer. A retainer's primary function is literally in the name. They are meant to retain teeth. That means to hold them in position. As a consequence, retainers are not very good at moving teeth. If the tooth movement is very small, they can work, but most retainers are ineffective for major tooth movements. So what can you do if your teeth shift after braces? If your teeth have significant shifting after braces, you'll have 2 options. Number 1 is get a new retainer to hold your teeth in their current position and avoid further shifting. And number 2 is get braces or Invisalign to move your teeth back into the proper position. There are some cases where an active retainer can be made to help move your teeth back into position, but these are generally only effective with very minor shifting. Any major tooth movement will require some form of orthodontic treatment, such as braces or Invisalign, to get them back into their proper position. Lots of people ask if wisdom teeth can cause your teeth to shift after braces. So wisdom teeth causing teeth to shift after braces may be a factor, but it's one of many to consider. It's difficult to say if wisdom teeth on their own will significantly move teeth. That's because people who are born without wisdom teeth still get teeth shifting. Also, people who have their wisdom teeth removed can still get teeth shifting. So getting your wisdom teeth removed, if recommended by your dentist, is generally a good idea for the healthier teeth, but it is most likely not going to prevent the shifting of your teeth. It is still recommended that everyone wears a retainer to prevent unwanted tooth movement, even if they've had their wisdom teeth removed. So how do you stop your teeth from shifting? The best chance you have to prevent your teeth from shifting is to commit to wearing your retainers for life. Our office recommends 2 months of full-time retainer wear, followed by nightly wear of your retainers thereafter. So this is a lifetime commitment, which doesn't always sound fun, but it is hands down the best way for you to protect your smile and keep your teeth in the proper position for life. It's also important to get your retainers changed periodically. If your retainer stops fitting well or shows any signs of wear and tear, that's a sure sign you need to get a replacement. For most individuals, replacing retainers once a year is a good practice. But even with good retainer wear, there is still a chance for minor tooth movement. This is sometimes unavoidable, but the goal is to do the best we can to maintain an aesthetic and healthy smile for life. So hopefully this video helped answer all your questions about teeth shifting after braces. If you have any more questions, feel free to ask them in the comments section below and we'll do our best to answer. If you found this video helpful, please give it a like and subscribe to the channel for more brace related content. Thank you so much, we'll talk to you soon.